According to some experts, the true burden of the death caused by COVID-19 is actually nearly at 300,000. That's 3 times the official death toll at around 97,000 or so, at least from government. The South African Medical Science Research Council estimates that at least 85% of excess deaths are COVID-19 related. Let's break it all down for you now. Bring in Professor Wolfgang Preiser, who's the head of medical virology at the University of Stellenbosch Health Faculty. He joins us now via our video link. And Prof, it's great to see you on this Monday morning. Thanks very much indeed for making time to speak to us. Researchers like yourself say the death toll is understated by a factor of 3. Essentially, give or take. As a quick reminder, how do you calculate that?
Well, that is actually colleagues of ours at the MRC, literally across the road from where I'm sitting here at Tygerberg. And the way that is done is that one looks at the expected numbers of deaths over a certain period in time, and then one looks at what is happening right now. And this is how they see that there are, in addition to the cases that are known to have died from COVID, there are another twice that number on top of that that exceeded the expected mortality. And of course, it doesn't prove that all of these people died due to COVID. It could have been incidental cases. I mean, for example, people not seeking health care for other conditions because of the outbreak, because health facilities were closed, and they were afraid to go there. And that is a phenomenon that's been seen in other countries as well. But it's also expected that a considerable proportion of these cases would have died from COVID, but not have been tested and therefore not have been notified officially as COVID cases.
Sure. That's a good distinction to be made, because hypothetically speaking, let's say we were dealing with, on the one hand, a pandemic, on the other hand, a locust outbreak, and both were fatal to humans. Excess death doesn't really tell us which of these realities actually lead to the deaths.
Exactly, that's absolutely true. And of course, one has to keep in mind that the pandemic and the lockdowns and the various measures that were introduced and things that just happened negatively affected healthcare in general. And we know that, I mean, intensive care units were full. That was the reason for the curfews and the alcohol bans to, keep people out of hospital for unnatural causes. But of course, other services like for HIV, for TB, for sexual health were also seriously disrupted. And some people say that is sort of the fault of government by implementing these lockdown measures, because now other types of patients, basically didn't get what they needed in terms of care. And that's, of course, not correct, because we know that during such an outbreak, people stay away from the healthcare system. And I think many of us that resonates with many of us, because we thought, well, let's rather wait till this wave is over. And that will have consequences, but we are not, or we're only beginning to see them, because we are here talking about more long-term, medium to long-term consequences like missed screening, missed treatment doses for TB or HIV, which is a big problem. But it's something which would not immediately lead to death, usually, but can cause problems in the medium term. And this is why it's so important for health services to return to where they were before and to try and catch up as much as they can.
Yeah. I mean, I guess you might have answered this implicitly already, but it's worth asking explicitly. Typically, researchers like yourself, scientists, measure things because there's value in knowing that particular set of statistics. What value do we get from knowing what the excess deaths are in a context where typically, for lack of a better term, the horse has already bolted? In other words, people have already passed on by then.
That is absolutely true. No, it's to get a better handle on how bad it was and to learn from it for the future. So, for example, looking at the excess deaths during the different waves and comparing that to the numbers of deaths known to have occurred due to COVID will help when the next wave comes. And this is really how we are seeing that the 4th wave caused by Omicron was clinically less severe. So we had an ameliorating effect, largely due to people having a degree of immunity due to past infection and immunization. So it is important to plan and, of course, to understand it better. And then hopefully next time one will be better prepared.
Yeah.
Also, I have to say, being in a laboratory myself, a diagnostic laboratory, we know that we are missing many cases of infection that are out there for the simple reason that we had to really limit testing in order to preserve lab capacity for those people who needed it most. So we are testing people with risk factors, we are testing people who are seriously ill, admitted to hospital. What we are not doing and haven't been doing for quite some time is testing all those mild infections out there. So we have a very poor understanding, and we know it's poor, of how many people had the infection in the first place. So we always need to look at different metrics as well. And in the case of infections, of any severity, the way to do that is to look for antibodies. So, and that is happening. So looking for antibodies in the population will teach us how many people got infected and how many more got the infection than what we diagnosed in the lab. And the same goes for deaths. So a proportion of deaths due to COVID are known to have been COVID deaths and others not. So none of these metrics is perfect. There are always, problems with all of these figures and the way they are calculated, but together they give hopefully a good picture of what the pandemic did and how next time we can try and deal with it in a better way.
Yeah, in fact, in the past, we've heard a lot of criticism around how testing anywhere in the world is skewed to those who are symptomatic, because it's only when you show symptoms that you present yourself for a test, largely speaking.
Absolutely.
On the back of that, how much weight do you reckon ought to be put on things like access deaths when, for instance, government and the National Coronavirus Command Council consider what the next steps ought to be in fighting the pandemic?
Yeah, I think it's a really good measure. That ultimately tells us how bad it was, and it complements the numbers of known COVID deaths. So it really revealed that the fourth wave, for example, was less severe, and this is partially due to the virus not causing such severe disease on average, but largely due to the fact that the vast majority of South Africans have encountered the virus already and therefore have at least a degree of immunity. We all know that breakthrough infections and reinfections are very common, so having had it or having been immunized does not protect from infection necessarily with Omicron, but it does protect still very well against severe disease, and that is really what we want. And of course, we can't look into the future. There are already some speculations about the next wave and how bad that might be, and we don't really know in which way the virus might develop, whether it'll become more dangerous again or whether it'll continue becoming less severe clinically. And that is all open, and we are learning as we go. There isn't an absolute truth. The world hasn't been in such a situation before, so we are really we need all the information we can get.
Absolutely. A lot of insight and incisive insight, might I add. Thanks very much indeed for your time. Really do appreciate it. Professor Wolfgang Preiser is the head of medical virology at Stellenbosch University's Health Sciences faculty. Once again, thanks very much indeed.